To the main focus of this bulletin, India has logged over 2.68 lakh new COVID cases in the past 24 hours, with the overall national COVID positivity rate shooting up to 16.6%. There's been a marginal dip in big metro cities like Delhi and Mumbai, which have driven the daily caseload in the country so far. But is that a result of low testing, or weekend curbs, or certain restrictions which are being put in? Or is it an actual indicator of the situation on ground improving? Remember, Delhi's COVID positivity rate currently is over 30%, which is the highest that the national capital has seen in recent months. And there are also concerns rising over people using home test kits and not reporting if testing positive. To discuss all these aspects and the current situation of coronavirus in the country, I am going to be joined on the show by Dr. Anil Dhall, HOD Cardiology in Janakpuri Super Speciality Hospital, Dr. Sanjeev Bagai, Chief of Nephron Clinics, and also by Dr. Rajeev Dasgupta, member of the National COVID Task Force. Let me go across to Dr. Sanjeev Bagai first. Dr. Bagai, what we can in fact see is that there is a situation we can see in certain big cities, to speak about Mumbai and Delhi particularly, where the numbers have dipped marginally. It's hovering somewhere close to the same figure, but it is slightly less probably than what we have seen earlier. Is that an indicator to see that as a good sign that the situation might be improving, or is it too early for us to comment on it, especially with regard to Mumbai, where we have seen a bit of a seesaw this week?
So a very early change in the, let's say, as a short interval of couple of days would not herald a decrease in number or decrease in transmission. In fact, just yesterday in the morning, there is a paper which is in a modeling study which has shown the Omicron to have a transmissibility as a R0 factor of 12, which is matching measles virus. So the real effect of the high transmissibility is that it spreads into the community really quickly. So if you try to gauge it over a very short period of time, you may get an answer. So the real summary point is that we are still early. The modeling study has also shown that normally between the second to the fourth of this particular strain of this variant. So for another 2 to 4 weeks at least, we have to utmost on guard. We have to continue to test. Any laxity in testing and early isolation when
Right. Dr. Bagai, thank you so much for your initial points. We'll also go to Dr. Rajeev Dasgupta, member of the National COVID Task Force. Sir, what we have in fact seen is, as Dr. Bagai was also saying, that it's probably a bit early for us to judge whether or not the situation is slightly improving, if not overall improving, especially in some of the big metros which have been driving the daily COVID caseload so far. But specifically about Mumbai, several experts earlier have opined that maybe it's looking somewhat similar to what we've seen in the South Africa trend as far as Omicron is concerned. Maybe it has touched its peak and now it's coming down, because we've seen largely a dip in Mumbai COVID cases this last week, except for one particular day, I think it was Thursday, when the numbers were up. Otherwise, it has largely been down. What do you think in terms of studying the Mumbai pattern? Is it too early to say that the situation's improving?
Thank you. First, Dr. Bagai made two very important points. One, that it spreads like wildfire, quite literally. And second, that these are minor fluctuations. And these cannot be, overemphasized. The other lesson, therefore, in this Omicron-led surge is, rather than new cases, it is really hospitalization and the clinical condition of those hospitalized. That's the ball on which we have to keep our eyes. And to add to that, today's cases are next week's hospitalizations. So while the new cases may show a bit of a dip, but it's really hospitalizations that we should carefully watch for the next couple of weeks at least, before we can be really confident that it's easing up, and that too a city-by-city case. Yes, it is quite likely that we will follow the South African trend, But at the same time, India, given its size and diversity, would be a country of multiple epidemics. So this will carry on through the country, certainly for several weeks, if not up to middle of March. But that would be city by city, state by state.
Right, Dr. Dasgupta, thank you so much for that opinion. We'll also take this to Dr. Anil Dhall. Dr. Dhall, what we are talking about also is the dip in numbers slightly in some of the big metros, but also let me bring in the point that there are concerns which both Delhi and Mumbai that we are looking at specifically have in fact raised, that a lot of people are actually resorting to home test kits, and that is not being properly tracked, because obviously a lot of people might not be reporting when they have tested positive. Mumbai today, in fact, has upgraded its SOP in terms of home testing kits, saying that it is mandatory now for people to intimate authorities, both the ICMR as well as the Mumbai civic body, in case they are using the kit to begin with, irrespective of whether they are testing positive. But if you could also tell us, like, what are some of the concerns that there could be in terms of home test kits and how that could become a big challenge to fight COVID as we look at the situation currently?
You see, having a home test kit is a great thing for people who don't want to get to a hospital, and doing a quick rapid antigen helps you in securing a diagnosis. And really, when something spreads like wildfire, we have to presume that a lot of people are going to get infected. We need to have a better process by which we can get a centralized account of what is going on, especially if we want to reserve certain samples for genomic sequencing and to understand how these variants of concern or the mutants are moving. But at the same time, we have to also understand that this, considering the way that it happened in South Africa and other geographies, till about 35%, 32 to 35% of positivity, we will see an increase. And this is actually slowed down now. There could be a variety of reasons, tests not being reported, people not getting themselves adequately tested. And yes, I agree with what Dr. Bagai and Dr. Dasgupta have said, is that we should not take this completely lightly, because we have been noticing that venous thrombosis, although not as rampant as in the previous mutants, is there. There is some cardiac involvement in a few patients, although not very severe as yet. And there would be some long COVID-like symptoms. I had a colleague who came in an hour ago and told me that she continues to have long COVID symptoms after what appears to be a milder COVID infection. So I think more than anything else, what we need to be concerned about is important groups of people like healthcare workers. If you have a whole hospital who gets infected, then who will take care of the patients? Nursing staff, sewerage workers, frontline workers. So that is where we need to be very, very cautious.
Right, Dr. Dhall. Also, let me take this question now to Dr. Bagai. And I'll probably ask this to Dr. Dasgupta as well, that, the states are, of course, saying that there's not been a major change in terms of the testing numbers. Although the testing SOP, as far as the center is concerned, has in fact been revised. It has said that everybody who's a contact of a COVID patient doesn't have to test. Asymptomatics don't necessarily have to go in for tests, etc. So having revised the testing protocol, could that be one of the reasons why we've seen a dip in numbers as well? Though the state governments maintain that there's not been a major dip in testing figures, but could we look at that also as one of the indicators, probably the reason why there's been a reduction in number, which could actually be which could actually throw the health authorities off to some extent, probably, if they are not, I'm sure they're cognizant of it, but nonetheless. Dr. Bagai.
Yeah, so this is, the home testing is always a huge white elephant in a room, which no one is seeing. The real issue is, it's very much like at-home pregnancy test. Who do you report to? How is the system tracked? When is the person doing the test? The timing of the test is important. If you do it too early, it will come negative. If you do it on day 1, day 2, it may come negative. Remember, the rapid antigen test has a great specificity, more than the sensitivity. So it is highly unlikely to miss a infectious most. sorry, but the infection most is between day 3 and day 6. The cycle of Omicron is not running for 5 days, it's running for 9.5 days. So you have to be careful till day 10. The important point, with your permission, I want to add is that everyone, even in the medical circles, is proclaiming this as mild. I would put a huge rider and a huge word of caution on this. Mild is extremely relative. Mild for me may not be very mild for other people. There is data which has come out from LA County last night, which has shown that all patients, all cause patients of Delta had an admission rate of 6%, and Omicron has an admission rate of 4.8%. So it's not too much of a gap if you look at it from sheer numbers. The real issue is because of the excess transmissibility, in the sense that one infected person in terms of asymptomatic carriers can infect 1 lakh people in 20 days. That's a huge number. And once it's into the community spread, it gets very difficult. The first published data, although it's non-peer reviewed as yet, has come out from the Omicron initial surge of end November to end December, mainly based out of Delhi data, in which it has shown 51% of patients are asymptomatic. And therefore, when your early symptoms of loss of taste or loss of smell is not there, you may just have mild body ache or a very, very mild sore throat, which, because of the rates being high now, both because of the hybrid immunity and the post-vaccine immunity, you may not actually bring it to the attention of the local doctors. So I think the numbers are more. We need to track the home testing kits. We need numbers, because the only way to contain it and not allow it to spread more than 2 to 4 weeks henceforth is early isolation. You have to identify the index case really early. And last 15 seconds is that you have to remove now through public messaging the huge stigma. I don't want people to feel that if you've got COVID, it's the end of the world. We want to reassure people that vaccines have saved lives. The vaccine campaign has been a huge success in India and perhaps has saved us through the Delta wave and now through the Omicron wave. We must promote the vaccines and an appropriate mask. Mask, not a cloth mask, not a simple surgical mask, not a bandana, not an ill-fitting mask, but a high specification mask. Please cover your nose. Your nose is your main barrier to prevent infection coming in, because your nasal receptors are more adapt to get in this infection. Please be careful. Another 2 to 4 weeks.
Right, Dr. Bagai. Dr. Dasgupta, as I was asking, in fact, do you feel that the revised testing protocols has, in a way, has it helped our fight in COVID, or do you feel that it's also giving rise to these people actually, probably using home testing kits at home? Because on the one hand, while the center is actually saying that not everyone has to get tested, revising the rules from earlier, but we can in fact see a spike in home tests across the country, not just in the metro cities. So in that regard, is this actually hampering or helping our fight against COVID?
No, it's certainly not hampering. It's meant to help. But there are other aspects to it, of course. Now, just to go back to last year's May 2021 advisory on home testing or self-testing kits, these are meant to be uploaded through the app to a central database, and that's how countries are effectively using home test kits. Now, self-testing kits broadly have 2 or 3 roles. One is to find out if you are getting symptoms, if you really are positive for COVID. Second, to protect other family members or individuals you may need to visit and they are high risk and you don't want to expose them. And third is in an institutional setting, where, as we are saying, and as Dr. Bagai was very rightly saying, that we are looking, Dr. Dhall was saying, for healthcare workers, we are looking at a veritable meltdown of human resource situations. And that really is the big challenge. And therefore, institutionally, there's a big role for these self-testing kits to see that most people remain healthy and you're able to isolate those positive very quickly and early. But without the lack of a central database, this is not going to be as effective as it is intended to be. And some of the videos of the testing kits, if you see, they show you, and that's what exactly the ICMR advisory is, to take a photo of the test results and to upload it through the app. Without that backing up the home test, it's going to lose a lot of its purpose.
That's right. In fact, that is one of the concerns voiced by state authorities and civic bodies as well. Dr. Dhall, I want to take this question to you. Of course, a lot of these revisions and a lot of these strategies that the centre has changed recently has been keeping the Omicron factor in mind. That is, of course, the biggest factor probably that not just India, but across the world, we've seen countries fighting. Now, in terms of the Omicron still being a factor, we've seen, of course, the numbers have exponentially gone up recently, and it's been a major concern, especially in metro cities, as we have been saying. But the COVID positivity rate also overall has gone down. But how big is Omicron still a factor in terms of the civic bodies now looking at, the strategies that they have to take? Because the Prime Minister has also, and state governments as well, because the Prime Minister also recently said that we should look at micro-containment measures rather than overall, measures like, let's say, a lockdown, for example, in order to curb the spread. So in tackling the Omicron challenge, how is that going to work out, or what is it that the state governments and civic bodies should focus on?
See, while I completely appreciate this problem between lives and livelihood, if there are no lives, there's less problem about having livelihood. But livelihood is certainly a very important thing, and that's why we don't want to have another lockdown. But at the same time, we should have a lot more public messaging to ensure that by individual maturity and collective maturity, we all take the right steps. And I'm sorry to add this, but some of the guidelines which come from time to time and advisories which come from national and state bodies do confuse the issue, because they would turn around and say, oh, testing is not required. Why are you testing people, especially, say, coming into a hospital? 2 days ago, we had to actually say that if we are performing, say, a treadmill test on a patient and the patient is not really wearing a mask, well, he could possibly be infectious. But the advisory does not support anything like this, even for invasive procedures. So I think the advisories have to be a little more sensitized to this understanding. Micro-containment works, but more than that, if we appeal to the maturity of every individual, every collective effort in RWAs and so on and so forth, we should be able to have people themselves offering containment. There has been a lot of confusion regarding isolation of contacts, home contacts, and even the government advisories were a little confused in that. But I think we should be a little more pragmatic and mature in making these guidelines, so that we try to minimize the rapidity of spread which Omicron holds as a challenge, just to ensure that all the vital frontline workers at least are available during this period, and the spread is slowed down. As the spread is inevitable, as Dr. Bagai has said, it's like a wildfire. It is inevitable, it will spread, but we will have better herd immunity. The vaccines really help, because many people are double vaccinated, especially those at high risk.
Right.
So I think at the same time, we have to continue doing more tests. Just as a matter of fact, in the last 24 hours, we have done 200,000 less tests. So this should not really happen. We should encourage testing. Like I said, like Dr. Bagai said, that there is a stigmatization and people are refraining from getting tests. People are worried. Actually, there should be more messaging to ensure that people are not hassled about this. There is no stigmatization. We are all breathing the same air. We can get infected. We can be asymptomatic carriers, and we have to be responsible and mature in handling this.
Right. I have to wrap up the show now, but I will have all of you actually give the last word on this. My main question is, this is, of course, the centre strategy, but in terms of the impending, the polls, the assembly elections coming up, and we know this is happening, of course, in certain states, but this is all, as we know that the large gatherings will have an impact on the neighbouring states as well. For example, UP will have an impact on Delhi. What is the message that you would give out as members of the medical fraternity to the state governments and to the centre right now, sir, in terms of curbing the gatherings when it comes to elections? Last word to all of you. We'll start with Dr. Bagai, then Dr. Dasgupta and Dr. Dhall.
Really, the message is only one. Any gathering, it can be religious, political, festivities, marriages, anything for any purpose at any place, in close quarters, with poor ventilation, with close proximity, is a sheer disaster. I think anyone who's trying to defend this is straight away is in Lulu land. You can't douse a fire unless until the entire fire is doused. Here we are lighting the fire and then expecting miracles to happen. The miracle is what we need to do. We need to wear a mask and keep away from crowds. This is my strong and earnest request. Lawmakers and policy makers can't become lawbreakers. Otherwise, we'll be left for nowhere.
Please. Right, Dr. Dasgupta, your last word on this.
Very briefly, both honorable courts and bodies such as election commissions actually allow certain congregations following COVID-appropriate norms, but congregations and COVID-appropriate norms can't simply go together. That's one. And second, any gathering in an Omicron context that is indoor, whether it's a workplace, whether it's a celebration, whatever it is, any gathering indoors is extremely fraught with risk. Thank you.
Right. Dr. Dhall, you will have the last word on this as well.
So actually, I think Dr. Bagai has put it very succinctly. This is an oxymoron. You cannot have gatherings and hope to prevent the spread of Omicron, which is highly transmissible. And there has to be some method by which people who are supposed to be custodians of law are responsible themselves, and they're wanting to hold high offices. They should be held responsible and accountable and to ensure that people don't gather. Because in India, more than even the IPL, the elections are the major source of relaxation, it is like a big arena going on there. So let's not treat it as a game. Let's be responsible and mature and keep distancing, and let there be some regulation which is put in, and there should be some punitive action taken against those who do not adhere to the guideline.
Right, Dr. Anil Dhall there, Dr. Sanjeev Bagai and Dr. Rajeev Dasgupta, thank you so much for all of you to join us on this very important discussion today as we keep our eye on the COVID situation in the country and what's the strategy, the best strategy for the center as well as the states to adopt in order to fight the third wave. Thank you so much for joining us.